For the sake of making the most of our time here this morning, I'm going to get us started as we have some more folks trickling in with us. But hello and good morning. Thank you so much for joining us today. My name is Danielle Hubley. I manage advocacy and education at the Partnership for Strong Communities. We're constantly expanding our own learning through this series, having conversations with advocates and leaders from other sectors, and exploring the importance of safe, accessible, and affordable housing uh, and how important it is to everyone and the impact that it has on their work and their lives. I'm so grateful to be in community with everyone who's here today to engage in more of this learning alongside us. Some quick housekeeping for today. Today's session is being recorded and will be published to the partnership's YouTube channel within the next week or so. We'll share the link to the full series in the chat. If you have any questions, please plan to use the chat box, which you'll find at the bottom right-hand side of your screen to add to today's conversation. The hour always goes by so quick, so we'll try to get to as many questions as we have. But if in the event we don't get to all of your questions, I'll ask our presenters to just share their email or a way that they can get in contact with you if you want to continue the conversation beyond today's webinar. We'll also share some resources alongside the recording for further learning on the topic, so much to look forward to during and beyond today's conversation. So with that, let me first introduce you all to the partnership and why we're hosting this series. The Partnership for Strong Communities supports equitable change in Connecticut housing policy by coordinating advocacy, advancing research, and uniting diverse partners. And our vision is that everyone in Connecticut has a safe, stable home affordable to them in an equitable community of their choice. And we believe that housing is a human right. Back in January, we released our annual State of Housing report, focusing on the lay of the land of housing in Connecticut. It brings visibility, clarity, and accountability to the housing challenges and opportunities that exist in the state. It's an incredible primer on what's going on in the state of Connecticut as it relates to housing issues and housing policy. So if you're looking to dive into further learning on the broader spectrum of housing policy, this is a great place to dive into some more of those learning and research and opportunities for improving housing policy in Connecticut. So focusing more on why we're here today, we know that a healthy housing system necessitates a comprehensive approach, intertwining housing affordability, housing creation, housing choice, and stability. We know that people need to afford their homes while meeting their basic needs. We need more physical homes across the state, period. And we need all different types of homes for people to choose from in all communities across Connecticut. And most importantly, people should have the right to safe, stable homes and to be supported from the experience of housing instability, evictions, and homelessness. This is how we weave a housing system which prioritizes the needs of our residents and that supports strong families and strong communities. This year, our series aims to highlight intersectional work centered predominantly around the concept of advancing housing stability, but even our priority areas regularly intersect with one another, and we often explore themes across all four of these buckets and many of the conversations we're having here today. But in focusing on housing stability, we know that it's closely linked to outcomes in health, economic security, mobility, childhood development, and educational attainment. Yet many Connecticut residents experience housing instability manifesting through couch surfing, homelessness, evictions, or foreclosures. These challenges have lasting impacts that go beyond the immediate loss of shelter, which undermine families' ability to regain stability and make it harder for children and adults to thrive. When we're thinking about intersectionality, we're referring to the interconnected ways that social categories like race, gender, class, and ability shape the opportunities and experiences that people have throughout their lives. These personal intersections are also reflected in the systems which surround us and support us, particularly when it comes to the homes we live and grow in. Housing isn't just a product that can be bought or sold. It's truly the foundation of our livelihoods and means so much more to us than just being a roof over our heads. And this quote is from Matt Desmond. I've had this quote written on my in my office since I started working at the partnership. It's just a strong sentiment that I think reinforces the root of why we're here today. And in our efforts to improve housing stability in Connecticut, the partnership also recognizes the importance of meeting specific population needs. Not every policy solution or intervention is going to work for every individual or family living in the state. And as such, having policies and programs that target the needs of particular populations and individuals allows us to better keep people stably housed throughout the course of their lifetimes. Today's webinar is specifically going to focus on the housing needs and experiences of Connecticut's aging population. According to findings from the 2025 Healthy Aging Data Report, approximately 885,000 people in Connecticut are aged 60 years or older, with nearly 28% of this figure living alone, living independently. In addition, Connecticut's demographics have been transformed by medical, social, and economic advances. There was a significant increase in the number of babies born post-World War II, generally recognized as the baby boomer generation. Not only did the population explode between 1946 to 1964, but many of those individuals are living longer than previous generations, which this demographic change is an important piece of the housing equation in Connecticut, and as housing needs are shaped by the circumstances and experiences which are subject to change over the course of our lives. So older adults looking to remain in the communities they live in and benefit from resources and services which support their ability to make choices, live independently, and with dignity. Which these values are challenged by a lack of available affordable housing in the state. Challenges like not being able to sell your home and downsize, being priced out of the rental market because of income restrictions, needing a home that is available near public transit, needing access to important life-saving services and accommodations in the home to support independent living. And there are many other healthcare and community support needs people will present with or benefit from as they grow older in life. So in order to achieve our vision of everyone in Connecticut having a safe, stable home available to them in a community of their choice, we have to remain aware and informed of the challenges households are presented with throughout the duration of their lives and how those experiences can in turn impact the landscape of available, accessible housing that exists in the state. And with that, I'm so excited to bring in our panelists for today. We've got a great lineup of speakers that I'm so excited for you to hear from. A reminder again to drop any questions that you have throughout the conversation in the chat. We will spend some time at the end of our presentation today answering any questions that you all may have. But without any further ado, I'm so excited to invite in Natalie Shurtleff to get us started. Natalie, I'll pass it over to you.
Great, thank you. I'm going to work on getting my slides pulled up. All right. Hello, everyone. I'm Natalie Shurtleff. I'm an Associate State Director of Advocacy and Community Engagement with AARP Connecticut. So excited to be here today to talk about this really important issue. So some people may think, well, why does AARP care about housing? Or maybe not familiar with our housing work. And so I like to share this story that goes back to really the origin of AARP. And so our founder, Dr. Ethel Percy Andrus, when she was a retired teacher and retired administrator, and she was helping do some outreach to fellow teachers, and she was asked to go visit another retired teacher, and she goes and knocks on the door of the address that she's given, and the person that answers the door says, "Oh, no, that person doesn't live here, but you can go check the chicken coop behind the house. I think there's someone there." And so Dr. Andrus goes back to this chicken coop and finds a former teacher that she had worked with living in a chicken coop because she didn't have safe, stable, affordable housing. And so out of that experience and other experiences, Dr. Andrus wanted to create an organization to help retired people and later, all older people to make sure that people have dignity as they age and aren't, left living in a chicken coop because they don't have any other housing. She founded the National Retired Teachers Association and then eventually founded AARP. So that's really at the core of who we are, is supporting people to make sure that they can live with dignity and make sure that they aren't living in a chicken coop. So out of this work, we focus on what we call livable communities, and it's providing a neighborhoods and communities where people of all ages can thrive. And so for us, that includes access to transportation, affordable quality housing, and the amenities in a community to make sure that people have what they need. As Danielle kind of alluded to in some of her numbers, Americans are getting older. By 2034, Americans 65 and older will outnumber those 18 and under for the first time in history. And as Danielle had talked about, there's a variety of different reasons for this, but baby boomers, people are living longer, and with this comes a change in housing needs. We used to think of housing of like the average American family as a mom and a dad and their two kids and their dog, a white picket fence. But those nuclear family households now only make up less than 20% of households. And like Danielle had shared, more people than ever are living individually. And so we need to think about what that means and realize that our housing stock still really matches the vision of the nuclear family and doesn't match the reality of people living independently. So, most people, as they age, they want to stay in their homes and they want to stay in their communities. They don't want to move. And if they do move, they don't want to move out of the community that they call home. But the majority, 51%, believe that they will move to allow them to age independently because they know that their current homes and communities don't support what their needs are going to be. So, as many of you are aware, there are a number of housing challenges, rising housing costs, not enough housing options. But I also want to focus a little bit on how less than 1% of homes in the US have features that support aging. So the housing that we have just isn't built in a way to support people as they age. And so, again, housing options, housing affordability, and housing accessibility is something that we lack. So, universal design and visitability, I always stumble over that word a little bit. But, we think about maybe installing a wheelchair ramp in a home when someone lives there who needs wheelchair access. But what about if you live in a home and someone with a wheelchair comes to visit you? I live in a pretty typical New England colonial house. And a couple years ago, my mother-in-law had foot surgery and was in a scooter for a limited period of time. And it was, fortunately, it was temporary. But when she came to our house for Easter dinner that year, it was a real challenge just to get her into the house to the first floor so that she could, uh, you know, enjoy dinner with us. Because, like many houses in New England, there are steps to get in the front door, and then there's a few more steps to get into the main living area once you are in the home. And that can be a real challenge if we don't have homes that are visitable by people. So, um, again, the majority of people believe that it's important to design homes to accommodate people of all ages and abilities. Um, and 56% want step-free entries on all newly built homes. We can do this. There are designs available, but that's just not how we build our homes right now. So I did want to talk a little bit about some of the advocacy work that we're doing in Connecticut. In this past legislative session, we worked on a number of different bills, and have in previous years as well. So along the lines of, addressing the need for more housing options. We were supporting the Golden Girls bill to ensure that, if people are living in their homes as they age and they're empty nesters now, their kids have moved out and they have a couple empty bedrooms that are just sitting vacant now. They want to stay in their home, allowing those people to rent out those rooms. And it really can be a win-win. They generate a little bit of extra income. They can, if they have a young person living with them, maybe that young person can help with things like mowing the lawn and shoveling the snow and have a real multi-generational benefit there. We also supported a uh, new bonding program that will allow people to apply for grants to make home modifications if they need to add those accessibility features to their homes. It'll be a grant program that they can receive some state funds to cover those costs. We also supported the caregiver tax credit, which is a little bit different, but one of the things that it can be used for is to make those home modifications as people need them. If you are caring for someone and that person needs modifications, you can use the caregiver tax credit to offset some of those costs. Um, so I'm gonna go through this pretty quickly, but there's also lots of examples of other states that are doing great things, specifically in the universal design and housing. New York, Maryland, Rhode Island, all have taken steps to ensure that more new housing is built accessible or is adaptable. Um, so definitely some things that we can be looking at to implement here in Connecticut. Finally, I just wanted to share some of our AARP resources, and I will be sure to share the link with Danielle so she can share it out after. But aarp.org/livable, and we have a variety of different resources and guides that you can either download and just have the digital copy, or you can request printed copies to be mailed to you. So thank you. And I think from here, I'm handing it over to Alyssa to talk about her work.
Hi, everyone. I'm so glad to be here. Just give me one moment while I get my slides up. And Natalie, thanks so much for such an informative and helpful presentation. So, my name is Alyssa Norwood, and I work for an organization around Connecticut community called Connecticut Community Care. And I get very excited about this issue because it's the everyone journey, right? We're all in changing minds and we're all in changing bodies, and we all have someone in our life that we love whose journey this might be now or in the future. So let me say a little bit about who we are, and then thanks again, Natalie. I can stand on the shoulders of your great work. So, Connecticut Community Care has been in existence for more than 40, actually, soon approaching 50 years, and it's an organization that helps people live their best lives at home with support and services and connections to loved ones and community through a service called care management. I'm the director of an initiative within Connecticut Community Care called the Connecticut Age Well Collaborative. And we work with town governments around this idea of fostering inclusive, accessible communities where we can all age well. And for those of you who could see it on the right, there's this really holistic framework that we use to talk about what it is to age well in community, because as a town leader, we're very conditioned around services, which are such an important part of the conversation, having places to aggregate, having connection to programs that helps fill specific needs. But as Natalie mentioned, this is a really holistic conversation. And of course, at the center of that ecosystem today is housing. So, Natalie, you did a little bit of your own storytelling, but I want to invite you all just to a brief kind of inward reflection. So I want to ask all of you, how would your home, where you live right now, if you're lucky enough to have housing, and community support your changing mind and body? So you can just kind of think for a minute. You might journey through the different rooms and think about how you would come in and come out. So just kind of hold that in your mind. Maybe some of you were experiencing that now or had an acute incident that gave you a taste of what it might look like if your mind or body changed in such a way. So the photograph here, this is actually my house. It's where I moved into now 13 years ago, and it's pretty emblematic of what Connecticut's housing stock looks like. So 70% of our housing stock is single family with bedrooms on the second floor. And interestingly, the kind of the peak of construction, this housing generally is designed for an average height male between the ages of 20 and 40. So the housing stock that we have was built for a very particular demographic. And as previous speakers have mentioned, that demographic in Connecticut is shifting and changing. So hold that part of the story for a minute. And I just want to shift a little bit back to Connecticut Community Care's work and then bridge these conversations together. So I want to talk about something called long-term services and supports rebalancing. For those of you that work in the aging sector, this is a familiar term. For those of you that reside primarily in the housing world, this might be a new concept. But the idea is that historically, maybe within the past 100 years, there was the emergence of institutional care, and systems were built around it that really resulted in a pretty robust glide path where there might come some either slow process or an acute process that the system said necessitated a movement into institutional care. And yet, as we heard from AARP's data, most people want to stay at home and community. So the idea of rebalancing is, if as a society we're making a lot of investment in institutional care, what would it look like to rebalance the system and have those same dollars be directed into home and community-based services and support so people could thrive at home? So this is the core of Connecticut Community Care's work. There are a number of different home and community-based programs that are available to people who are enrolled in Medicaid. So there are all kinds of requirements related to income and assets. That's beyond the scope of our conversation today, and we're not going to dig into the details of these. But some important points is there are a variety of different programs. Some of them are for older adults specifically, some are open to all ages, and some are for people living with physical disabilities. There's also a range of availability. Some of them are entitlement programs, meaning that if you meet the criteria as of right, you receive access to the program. Others have funding caps, so there are waiting lists to be able to enter them. But one that I just wanted to mention today is a program called Money Follows the Person. It's a federal demonstration program, and here's how it works. It's available to anyone, regardless of age, that's living in a qualified institution. So that means a nursing home or a hospital or a mental health facility. And depending on the details and the particulars of your circumstance and the state that you're in, if you've been in that facility for at least 60 to 90 days, and you have an interest in leaving the institution and living independently and can, the dollars, hence the money follows the person, can be redirected to move into a community setting. So here's, of course, the housing connection. There are huge challenges with respect to housing. So somebody might be able, interested, and have all of the supports in place to transition back to community, but there's nowhere for them to go. So some of you might be familiar with this data. If you're not, this will be in the links that are distributed later, but I encourage you to check out this report from the Urban Institute. It's about 5 years old now, but the data is still extremely relevant, and it talks about the intersection of affordability and accessibility among other data points. So a couple of key metrics from this report as of that point of time. So one, the report did a comparison of housing needs and supply, and at that moment in time, Connecticut had a gap of 86,000 units of affordable housing, meaning based on people's income and the availability of affordable housing, that the state as a whole was 86,000 units short of need, and that's at the 30% of county median income threshold. And then the second really interesting piece of information is according to demographic projections. So we know based on the data that you've already heard that we have as a percentage of the population and also in absolute numbers, increasing numbers of older adults. We're living longer and healthier lives than ever before, but also in increased amounts of, in some cases, physical disability, which is not an inevitable consequence of aging, but can be correlated, that we also need more accessible housing. So, according to those projections, in terms of assisted housing in the future, at least 1/3 of it needs to be accessible. So there's this broad challenge that Connecticut lacks not only sufficient affordable housing, but also sufficient accessible housing. So Natalie spoke to some of the policy work that's being done in the state, and I want to talk a little bit about the Connecticut Age Well Collaborative because we have a little bit of a different approach to systems change. And for those who aren't familiar, there's an article that was published in 2018 called The Waters of Systems Change. Some of you might be familiar with it, but for those who aren't, this is a reverse pyramid. And if you look at the top, for those of you that live in the world of advocacy, that top line is probably a pretty familiar place where you're spending time working to change policies, to change practices, and to redirect resource flows, right? Predominantly money. And that's where we all exert a lot of effort, particularly in this moment. However, there are these other dimensions to change that are right under the surface, and those are around mental modes, relationships and connections, and power dynamics. So, what does it look like to influence these implicit and semi-explicit spaces? First, as a means of strengthening the way we do our work in the policy realm, because there's a lot of invisible stuff that happens here. So, what do I mean by that with respect to aging specifically? So I want to talk about ageism. The definition may or may not be self-evident. So just so we all have a shared language, it's the systematic stereotyping, discrimination, and oppression of older people. I'll name that oppression based on age can happen at a variety of different ages. There are different names for that if it's happening to younger adults, but our conversation today is specific to older adults. And like many isms, there are three different levels of this: institutional, interpersonal, and internalized. So just to kind of give some color to this and some examples with respect to the housing world. So what's an example of institutional ageism? So exclusionary zoning and building codes. If town-wide, there's a barrier to being able to create an accessory dwelling unit, or if there's barriers to creating, when there's a demonstrated need, multifamily housing that can also serve as multi-generational housing. That's an example of institutional ageism, right? Oppression of older adults based on a systemic policy. Then moving down to the interpersonal level, right, between two different individuals, a landlord might make an assumption that based on someone's age, so stereotypes arise from statistics, right? It is true that as we move through time, as our bodies and minds change, that there's a higher likelihood of accumulated challenge in the way we think, the way we move, but it's not an inevitability. And when we make the determination that an entire group shows up in that way, we've traversed from statistics to stereotype. So when a landlord assumes that somebody is frail or dependent just because they're old and steers them toward bottom floors of buildings, or makes assumptions that somebody has a fixed income based on age, we're now in the realm of interpersonal ageism. And then internalized ageism, how does this show up in our individual behaviors? What societal messages, if I am an older adult, as I will be if I'm lucky enough to live that long, have I taken in? So I might avoid some of the modifications that Natalie mentioned because there's a stigma associated with putting a grab bar in my house. There's some kind of admission that maybe there's a weakness because society has certain incorrect messaging. Or I might prematurely downsize when I'm very able to take care of a certain size house because, again, society has fed me messages that because of my age, I either don't have a right to live in a bigger space or I'm not able to live in a bigger space, which may or may not be true. So it's interesting, like other forms of oppression might be more visible. This is one of the more invisible forms of oppression. It's become so normalized in the fabric of our discourse that we don't even see it. So a lot of our work as an organization is really laying the fertile ground for introspection, self-reflection, and self-correction so that when other organizations, we don't do advocacy in the way that others do, but with this increased awareness of our mental modes, that we can move forward and have policy solutions that are grounded in anti-ageist solutions. So how does that show up in our work specifically? So there are five main pillars of what we do in helping local governments, which is our primary target audience. So we do education work. We have a variety of tools and programs that I'll talk about. We start conversations about ageism. They're really important. So if this isn't something you've thought about much, I encourage you to start some dialogue in whatever your community looks like and however you define that. We lift up lived experience and we bring local governmental leaders into partnership with older residents who have lived experience of aging. And then we celebrate those things and then we bring the communities who have done that work together into a peer learning network. So just to touch on each of those before I pass things over to Jim. So education, three main resources that are all available on our website and they'll be distributed later. So one, we have an educational series called the Age Well Academy. It's open to anyone, but it's specifically tailored to local governments to talk about how we do better in the realm of age inclusivity. It's not specific to housing, but certainly includes conversations about it, but it's a holistic conversation about age inclusivity. We also have a resource guide series that's specifically tailored to local governments that point by point across a variety of different areas talks about how to promote inclusivity. And then Danielle cited the data, but we work in partnership with the UMass Center for Gerontology. This is the second report now. The first was 2021. The second came out in 2025. So it's neighborhood level data on health demographics and well-being of older adults. And Connecticut was the first of 4 states in the nation to have this data. So it's really exciting and unique to be able to look at it through this age-based lens. So we're really pleased about that. In terms of conversations, the kind of easiest touch point, something you could do today right after the webinar, is we have a conversation guide called Every Age, Every Ability that invites people into the space of thinking about ageism and how it shows up unconsciously and what to do about it. We also wrote a book. It's called A Kid's Book About Ageism, and we have a conversation guide associated with that as well to facilitate these conversations across the age spectrum, not just among older adults. And then finally, we have a 2.5 hour workshop we've done with a variety of towns now in Connecticut called a Daring Dialogue that's about exploring our own internal biases around ageism. In terms of partnership, we have a year-long program called the Community Leaders Fellowship that, again, that's really designed to create this intensive partnership and collaboration between community members with lived experience and local leadership. And one of the projects, West Hartford and Newtown, were two of our towns who participated last year. They made a series of posters to start dismantling narratives around ageism. So it's small, but it's available on our website. You could check it out. I'll point out the one on the bottom right. So these are all community members who decided what words they wanted to be used to describe as they age. They decided where in town they wanted their photographs taken. So one of our fellows who said, well, I don't really have anything special about me, on the bottom right, who had to decide among which of her motorcycles she was going to bring to be photographed with in front of the Newtown Senior Center and be described as bold. And for those who live in West Hartford, this has actually trickled into a townwide campaign. If you live in or near West Hartford, you'll see a series of banners all along Main Street where residents across town sent in photos and words describing how they wish to be aged to start dismantling ageism and creating a conversation. We also recognize towns. So we have a series of awards that we give. One is called the Wellspring Awards. It's to honor organizations and individuals who have made outstanding commitments to age inclusivity. And then for those who haven't seen this yet but are interested, our nominations are open till June 30th. We have a program called Age Well Across Connecticut, where it's a very grassroots organic list that gets created every year, but basically it's an annual community nominated list of places and programs that are recognized for age inclusivity. Broadly conceived, it could be a favorite trail or park, it could be a business, it could be a cafe. So if there's something that excites you in your town, you want to lift up, feel free to nominate it to the list. And then this September, we're having a annual celebration called Age Well Fest. It's a half-day, two-part learning and networking celebration for Connecticut communities. So we hope to see you there. And then the last piece that I mentioned is our brand new, soon to launch later this year, Age Well Network. We've had enough communities now who have begun to work with us that there's an interest and appetite in creating a space for towns to come together and cross collaborate, mentor each other, exchange knowledge, resources, and provide mutual accountability and support to keep moving this work forward. So, if any of this excites you the way it does me in terms of what's next, I'd encourage you to sign up for our e-news. There'll be links to all of these opportunities in the follow-up from the partnership. So feel free to find out about the various programs that we do through that avenue. We're also really excited about our Age Well Fest event in Wethersfield in September. We still have some sponsorship opportunities available. So if you are connected to a business or know of a business that would like to get some visibility and be associated with this great work, please let us know. And then finally, if you are in municipal government broadly conceived, whether a commission member or a local elected official or a staff member, and you'd like to have your town get more involved, you can email us and schedule a 15-minute discovery call, and we can find out what the right next step is for you. And thrilled to be here, and thanks for the opportunity to present. And Jim, I'll turn it over to you.
So I want to thank everyone for being here this morning. My name is Jim Feralis, and I'm the President and CEO of Continuum of Care. Continuum is a private nonprofit service provider, and we provide a range of services across the state: group homes for people with intellectual and developmental disabilities, supervised apartments, supportive housing for people with mental health and substance use disorders. We also provide crisis services. We have the first crisis stabilization unit, community-based here in New Haven for adults. And people can access that as an alternative to going to the emergency room. It's called the Rest Center. And the number for that is very easy to remember, 1-855-GO-FOR-REST. Again, it's an alternative to the emergency room if you're having a mental health crisis. We also have a mobile crisis team that works hand in hand with the police department, providing secondary on-call to mental health crises. A lot of times police are not able to, nor are they really in the arena of providing mental health counseling and services. So we work with them. And then finally, we started working with homeless individuals. We've had them throughout the years entering any of our programs. However, we ended up starting the first non-congregate housing program, emergency housing here in New Haven. And one of the first things I found when I started meeting with some of the individuals is that we had a lot of older individuals. So let me just talk about what the problem is nationally. So every year HUD, which is the Housing and Urban Development, they require a point in time count in order for any funding that's going to go to a local entity. And across the nation, there are an estimated 146,000 older adults over the age of 55 who were homeless on a single night in 2024. The latest report available in 2024 is the AARP, the Annual Homeless Assessment Report presented to Congress. And what they found is nearly 20% of all people experiencing homelessness are over the age of 55. The Government Accounting Office projects that number, because you've heard in previous presentations, the baby boomers, we have a lot more people aging, and we have people that we anticipate the number of homeless will triple by 2030 for people over the age of 55. And finally, the National Alliance to End Homelessness has seen at least a 23% rise since 2019 of first-time homelessness across all age groups, with older adults increasing at much higher rates. So what's happening in here in New Haven? Just one county in Connecticut. What we find is 30% of homelessness in New Haven County are over the age of 55. And as I mentioned before, across the country, it's about 20%, but Connecticut having higher rental units is contributing to that problem. Right now, there are 516 people who are aged 55 and over currently on the by name list. By name list is something that is managed through the Homeless Management Information System. Each county has a coordinated access network, a CAN, and in order to be added to that list, you call 211, you end up getting an appointment, you get a housing assessment, and if you're determined to be homeless or without housing, you're unhoused, then you're added to that list. So currently, just in New Haven County, we have 516 people. Of that, 336 are over the age of 60. At least half are currently living outside, and that may be in an encampment or in their car. While there are another 160 that are currently waiting just to get into a shelter bed. Over 100 are chronically homeless, as defined by HUD, and I'll talk about that on the next slide. Over 200 have disclosed a disabling condition. And again, out of that number, 81 are veterans. So Continuum of Care, the agency I run, operates a 100-bed emergency housing program. And in that program, we actually have more than 40 guests that are over the age of 55, with the oldest individual at 87. About 20% have been approved for housing subsidy voucher, but they're not able to locate an ADA unit. And as you heard in previous presentations, we don't have accessible units that are available to individuals. And currently, the waiting list just to get into senior housing can be anywhere from 2 to 5 years. So why is this happening among older adults? The driving force is income. And for a lot of individuals, they're on Social Security. That may be their only income source. And right now, the average Social Security check is $2,071. And over the years, single-digit increases in Social Security is not keeping pace with double-digit increases in rent and other housing costs. So just the math alone doesn't work. And then you have life-changing events, decreased income due to job loss, inability to re-enter the job market. As rents are going up, it's easier for a younger person to go out and get a side hustle, get a second job, a third job. For someone who's in their 60s, it proves very difficult to go out and get any kind of second job or another job on top of what they're getting from Social Security. Vulnerability to chronic health conditions. One woman I met, she's living at our emergency housing program. She worked for over 35 years as a CNA, a certified nurse's aide. She had a 401k plan. She ended up needing to have knee surgery. While she had that surgery, she ended up becoming septic, had an infection that settled in her spine, began to have back problems. She's currently on a rollator. She uses a walker and rollator to get around. She ended up losing her job. She was on short-term disability for a period of time, applied for Social Security disability, was found ineligible. So she's still without any income, living in a homeless shelter. And this is a woman who worked her entire life and even had a 401k plan, which she exhausted due to medical expenses, as well as being at risk of being evicted. Or the other reason why people may end up homeless is the death of a spouse. A lot of times people depend on two incomes, two Social Security checks. And there was a gentleman in his 70s that I met, and he talked about how he and his wife had plans to travel and retire and enjoy retirement. He served in the armed forces for a number of years, but never retired with a pension. After exiting the Navy, he ended up being a painter, a house painter, working for a contractor. So he eventually got Social Security, but it was a lower amount because he never paid enough into Social Security. So he got about $1,400 a month in Social Security. His wife, however, was a school teacher. She worked for 35, 37 years, got full retirement. However, after she retired, she ended up getting cancer, ended up dying a couple of years later. The pension that she took out only covered her, it did not cover her husband. So once she passed on, there was no pension for the husband. So he was left to live on just his $1,400 a month. He did find an apartment in a basement, renting from a landlord who lived upstairs, lived there for about 2 years. And then one day the marshal showed up to evict him as well as the landlord upstairs, because what he found out was all that rent money he was paying $1,000 a month went to the landlord, who was spending it gambling, and she never paid the mortgage. So here he was, homeless for a second time, doing all the right things, having this Social Security income in place, planning for retirement, exhausting his 401k, whatever he had. And this was something that I started thinking could happen to anyone. The other area is the lack of prevention efforts or service coordination. We have two service systems, senior services, and we have homeless services. And there wasn't a lot of overlap between the two. And there's also a lack of planning for affordable housing. Many people don't think about down the road, as their income isn't necessarily growing to match the rent, they're not necessarily thinking about applying for affordable housing options, getting on a waiting list for senior housing until it's too late. We have a lack of housing options, not enough deeply affordable, especially people who aren't necessarily getting the maximum Social Security check. Lack of ADA compliant housing units. Even most shelters are not even ADA accessible. A lot of shelters have bunk beds. A lot of elderly individuals, seniors, are not able to use the bunk beds. And that's why we have a lot of elderly people living in their cars and living out in encampments. And then finally, chronically homeless or aging. So those people who are considered chronically homeless, people with mental health, substance use disorders, experiencing long-term homelessness, are now aging along with baby boomers because they have never either obtained or maintained stable housing. So what are we doing here in New Haven? After meeting with some of these clients, I decided we need to do something. And so I worked with the Greater New Haven Regional Alliance to End Homelessness. We developed a work group focused on addressing older adults in the homeless service system. And we have about 15 to 20 different providers who meet monthly. And we just started in November. So we've done a lot just in the last 6 months. Some of what we've done is we developed an online resource guide sharing resources between senior services and homeless providers. We also held 4 different focus groups for older adults to look at what are some of the driving forces that is bringing them to our homeless shelters. We had we set up the first housing resource fair held on May 18th. We had over 30 service providers representing housing, senior services, behavioral health providers, homeless services. And then at that very resource fair, we held 4 separate 30-minute training sessions for case managers focused on DEMIS, which has a nursing home diversion program, to talk about what kind of resources are available, to talk about some of the Medicaid waiver services that are available. And then we also had another training with Area Agency on Aging, just to hear about what kind of services are available through that resource. And then what's next? So we are continuing to review all the data from the focus groups that we've had. We're looking to develop a plan to address those priorities. We also are looking at using this existing work group that we have to develop a case conferencing component to give providers an opportunity to present cases that may be challenging and that may benefit from multiple providers discussing all these options. And then we're going to continue to outreach to engage existing senior housing providers, residential care homes, assisted living facilities, offering opportunities to collaborate and leverage services from members of the work group. I will be making a copy of this available that the partnership will send out to everyone attending today, but I've included a couple of videos on why the increase in elderly and older adults experiencing homeless. And then I also have resources that are available here. So at this point, I will stop my presentation and I'm going to turn it over to Joan, who will talk about her own experience. So Joan.
Thank you so much. This webinar has been so informative for me as an old person. But my story starts in 1989 when my husband and I knew it was time to downsize from a large house since our children were no longer living at home. We decided to go condo, and so we did not have to worry about outdoor upkeep. We moved to Litchfield, Connecticut. We had to give furniture away to family. We sold some antiques to dealers. And it was difficult giving up certain items that we had collected through the years, but it was time to scale down. We enjoyed many years of retirement in Litchfield, being able to travel and play golf and visit family until my husband passed away. And then after that, I realized I could no longer keep the home that we had was no longer affordable for me. But I wanted to stay in the Litchfield area. So I submitted my application to Litchfield Housing Authority. And after my application was approved, I sold some more furniture and collectibles, and I moved in with my single daughter in a nearby town until an apartment was available. I waited 2.5 years before the apartment was available at Bantam Falls in Bantam, and I settled nicely into a 3-room apartment on the first floor, which gives me access to a patio and a small garden space. I have been living at Bantam Falls now for 7 years. Rent includes heat, electricity, water, which helps expenses when you're on a fixed income. The laundry room and mail room are inside, which is very convenient. And we have a community room that accommodates various activities available to those who are interested. We exercise, we have potluck dinners, they play bingo, we have a jigsaw table, and we also have a library and a video room. And although I thought I didn't need them, I got used to using grab bars. Alyssa alluded to that. And I'm reluctant to shower anywhere else without grab bars. Each apartment has the emergency cord in the bedroom and the bathroom, which activates a light over the apartment door in the hallway, and neighbors respond to the emergency, and call 911 if necessary. So we always have people around us. We're not isolated. I've noticed recently that some residents could use handrails in the hallways for safety balance if they're not using their cane or their walkers. There are 36 apartments here at Bantam Falls, and the residents socialize very nicely, and they form friendships with neighbors, which is so much better than being isolated. We meet our neighbors at the mailbox, walking outdoors, or just sitting outdoor on the front porch in the warm weather. We have a maintenance man who's available for any problems we have in our apartment. We write up a maintenance report, and he takes care of it in a timely manner. Our complex was originally well designed, I should say, over 30 years ago, and has been well maintained. Upgrades are now in progress to maintain a sound building. Kitchens are being updated, including new appliances, and bathrooms will have walk-in showers instead of bathtubs, which are not easily accessible to some as we get older, the ADA apartments. Bantam Falls is situated on a dead-end street off the main road, and we're near the post office, the fire department, the ambulance service in case of an emergency. Help arrives in a matter of minutes. Bantam and Litchfield are lovely towns to live in. We have everything we need within a 3 to 5 mile area. Supermarkets, restaurants, banks, hardware store, hair salons, doctors, dentists, physical therapy, and a short distance from Charlotte Hungerford Hospital. Bantam offers social services to town residents who are no longer driving and need transportation to their doctor's appointments or for shopping. And they also plan trips for those who are interested. We're a strong community here at Bantam Falls. Some residents have lived here for 10 to 15 years. There's a long waiting list, so it takes over 5 years for anybody to get in. But we're all happy here, and I'm glad to be in Litchfield, Connecticut. I moved originally from New Jersey, but I've been here for over 37 years. Thank you for including me in this webinar. Thank you, Danielle.
Thank you so much, everyone. Appreciate all of our presenters and their incredible insights and for sharing their stories, adding a little bit of a personal touch to this broader policy conversation we're also having across the state.